At Froedtert and the Medical College of Wisconsin, we have seen an expanded array of cases that we've been able to treat with Gamma Knife Icon. The ones that we have really capitalized on Icon's fractionated workflow is with the retreatment of meningiomas. And we have found that these lesions, especially those in close proximity to critical structures, are able to be more safely treated with a fractionated approach as opposed to a much more protracted course of treatment that we would treat with on a standard accelerator. We can get patients' treatments done within 3 to 5 fractions of radiotherapy, as opposed to the alternative of having them treated on a standard linear accelerator where their course of treatment may be 5.5 to 6 weeks. So from a patient's convenience and for their comfort, this has really been a great tool for us to offer to our patients. We just had a unique patient treatment occur on Icon that we wouldn't have been able to do in any other way other than with this device. This is a patient who had multiple metastases, I believe at number 9 total, from the top of their head literally down through the bottom of their cerebellum. And some of these lesions were quite large actually, and I had a bit of trepidation with treating those larger lesions with a single fraction of stereotactic radiosurgery, especially in the posterior fossa. However, Icon, and with the planning system that we were able to, and the plan that we were able to come up with on the planning system, we were able to devise a treatment plan that incorporated both single fraction treatment to the smaller metastases and do multi-hypofractionated treatment to the larger metastases. And so the patient's first treatment day was somewhat longer because we had treated many of those single lesions with a single shot in addition to the first fraction of 5 to those larger lesions. And then on the subsequent days 2 through 5, his treatment time was much shorter because we were only treating those larger lesions with the remainder of the fractionated therapies. There's not another machine or device that would have been able to offer that flexibility and specificity for treatment of those lesions. And the patient's doing great, and we couldn't have been happier with how that treatment plan turned out.